why is the volume of distribution of a drug imaginary? Shouldn't volumes be real? Let's explore this on Learn Efficient Pharmacology. Pharmacokinetics, Part 15. Assume that our body is like this tub containing 100 ml of water. Let's add 100 milligrams of a drug that disperses evenly throughout the tub. The concentration of the solution can be calculated using the equation concentration is equal to amount by volume is equal to 100 milligrams divided by 100 ml is equal to 1 milligram per ml. Conversely, if we know the amount of drug added and if we measure the concentration of the drug in water, we can calculate the volume by rearranging the equation as volume is equal to amount by concentration. Since we assume that the tub is like our body, let's replace the amount of drug with dose D, and since in the body we usually measure concentration from plasma, let's replace concentration with plasma concentration C. The volume into which the drug distributes is volume of distribution Vd. Thus, Vd is equal to D by C. In the body, the volume into which the drug distributes includes both the plasma and the space outside the plasma, that is tissues. Here, let's assume that this 100 ml consists of 10 ml of plasma and 90 ml of tissues. Since the drug is evenly distributed throughout, the plasma concentration will be 1 milligram per ml as we saw earlier. Vd can be calculated as Vd is equal to D by C, which is equal to 100 milligrams divided by 1 milligram per ml, which is equal to 100 ml. This we know is the actual volume. But there is a problem here. Generally, in the body, the drug is not evenly distributed. So the concentrations in plasma and tissues are likely to be different. But we still use the plasma concentration and not tissue concentrations for calculations because the plasma concentration is easier to measure. How would this work out? To understand this, let's consider another drug that distributes more into tissues. As before, let's add 100 milligrams of the drug. Now assume that most of it, say 99 milligrams, is distributed into the tissues. The remaining 1 milligram is now present in 10 ml of plasma. So the plasma concentration is 1 milligram in 10 ml, that is 0.1 milligram per ml. Now what would happen if a person who is unaware of this unequal distribution calculates the volume of distribution? Vd is equal to D by C is equal to 100 milligrams divided by 0.1 milligram per ml is equal to 1000 ml. But we know that the actual volume is not 1000 ml but only 100 ml. Then how did this happen? This was because the person assumes that, like in the previous scenario, the drug was evenly distributed. So he measured only the plasma concentration and assumed that the tissue concentration would also be the same. Since this assumption was incorrect, what he ended up calculating was not the actual physical volume but a hypothetical volume or apparent volume. This calculation of volume of distribution Vd, assuming that the drug is distributed throughout the body at a concentration equal to that in plasma, forms the basis for the definition of Vd. It is called apparent because it is inferred or estimated from the plasma concentration. As we saw, it does not necessarily correspond to a real measurable volume in the body. Now, if Vd is only an apparent value, how can it be useful? In clinical practice, it allows us to understand the extent of drug distribution based on plasma concentrations alone, without having to measure tissue concentrations. As we have seen here, a drug with a large Vd tends to distribute more into tissues relative to plasma. Now let's see what happens when a drug distributes minimally into tissues. Let's add 100 milligrams of a drug, and since the distribution into tissues is minimal, assume that a mere 1 milligram distributes into tissues. 99 milligrams remains in plasma. Then the plasma concentration would be 99 milligrams in 10 ml, that is 9.9 milligrams per ml. Now let's calculate the apparent volume of distribution of this drug. Vd is equal to D by C is equal to 100 milligrams divided by 9.9 milligrams per ml, which is equal to 10.1 ml. Take a closer look. This value is almost equal to the volume of plasma. So for a drug that distributes minimally into tissues, its Vd is approximately equal to the plasma volume. Well, it is common sense that a drug that is not distributed into tissues is likely to be confined to plasma. Hope you enjoyed this video on volume of distribution. Do check out our previous video on clearance. In the next video, we will see how these two pK parameters help us to achieve and maintain a steady state plasma concentration. Here are some good to know facts. This is a summary of our discussion.